Welcome to this clinical walkthrough on the normal PSA results case for UKMLA, brought to you by Mediate, your 24/7 practice partner. All right, let's get into it. This is a classic PLAB 2 station, so listen up. We're going to tackle this in 5 simple stages. First, we'll set the scene. Then, we'll cover how to deliver the good news, explain the management plan, nail the safety netting, and wrap up with some solid lifestyle advice. Okay, first up, setting the scene. So, picture this. You walk into the OSCE station. You've got an asymptomatic patient in front of you. They're here for one thing, their PSA result. And good news, you already know it's normal.
So, what's your goal here? It's pretty simple, actually. You have 3 jobs. Tell them the good news, explain what happens next, and give them a bulletproof safety net. You do those 3 things well, and you're going to ace the station.
All right, let's talk about how you kick things off. The way you start this conversation is absolutely crucial for building that instant rapport and trust. What's the best way to do that? Get straight to the point. Give them the good news right from the get-go.
Think about it from their perspective. They're anxious. Your very first sentence needs to put them at ease. So no complicated medical speak, okay? Keep it simple. You want to give them that immediate sense of relief. That's what shows the examiner you've got great communication skills.
And here is the exact phrase you should use. Seriously, this is a golden phrase. It works because it's simple, it's positive, and it tells them what they need to know immediately. Just say this: your PSA level came back within the normal range, which is very reassuring.
Okay, so they're feeling relieved. You've given them the good news. What's next? Now you have to walk them through the management plan. They need to understand what this normal result actually means for them long term. And the best way to do this is to break it into 2 super clear steps. Step 1, let them know that no more tests are needed right now. Step 2, talk about the option for future testing. Keeping it structured like this makes it so much easier for the patient to take in.
So, let's dive into step 1. You need to be explicit here. Tell them straight up that based on this result, there are no current concerns. This really hammers home that good news you started with.
And here's how you can phrase it. This works so well because it logically connects the no concern part with the no further tests part. It just makes sense to the patient. Say something like, there's nothing concerning at the moment. You don't need any further tests unless new symptoms appear in the future. Now for step 2. Look, the patient might have their own thoughts on future screening. Maybe they read something online. You need to get ahead of that. Address it proactively and be really clear about what to expect.
This is a great way to put it. It puts the ball in their court, which is empowering, but you're still giving them clear medical advice that it isn't mandatory. It strikes the perfect balance. You could say, you're welcome to repeat the test every year or 2 if you like, but it's not mandatory unless something changes.
All right, let's move on to something that is absolutely non-negotiable in any OSCE: safety netting. You have to get this right. It's crucial for the patient's safety and honestly for your marks too.
And the most important thing here is to be crystal clear. No vague advice. You need to give the patient a specific list of red flag symptoms they can actually remember. Tell them exactly what to look for and when to come back. Here's your go-to line for safety netting. It hits all the key symptoms you need to mention. You need to know this by heart. Saying this clearly and confidently shows the examiner that you're a safe pair of hands.
You can practice this exact case right now and get objective feedback on mymediate.com.
Okay, we're almost at the finish line. To take this consultation from good to great, you want to add a bit more value. And you do that by offering some lifestyle advice. This shows the examiner you're thinking about the whole person, not just the test result.
And remember, keep this advice simple and actionable. This isn't the time for a big lecture. You're just giving a few helpful tips to wrap things up and show you're focused on their long-term health.
So, what should you mention? 4 things. They're all evidence-based and easy for a patient to remember. Talk about staying active, eating more fiber, cutting down on red meat, and stopping smoking. And hey, if you can, offer them a leaflet. It really helps the information stick. And that's it. If you followed these steps, you are going to be so prepared for this station. You've got a clear structure, you've got the right words to use, and you're showing a safe, patient-focused approach. You are absolutely ready to walk in there and handle this with confidence.
You can practice this exact case now on mymediate.com.